Thank you so much. Thank you, Sarah, and thank you, Erica, for allowing us the space to speak on this important work of ARI. And also, thank you to all the partners, all the students and supporters, fellow supporters of this work, and colleagues that are on the call as well. Uh, I'm going to take it over here and start my slides here and introduce a few of my colleagues that are on the call as well. There we go. So first, we're going to start off with my colleague here, Katya. Katya is, Katya is a planning specialist for Ramsey County. She came to Ramsey County in 2023 after about 10 years working in a nonprofit serving newly arrived refugees and immigrants, including survivors of torture and asylum seekers exiting U.S. detention facilities. While working as a program manager in refugee resettlement, Katya was part of a small statewide team that planned for the emergent reception of Afghan refugees and has supported hundreds of families from around the world with their transitions to life in Minnesota. Katya is also a mama in a bicultural, multilingual family and VBAC advocate. Katya is passionate about ensuring that folks with lived experiences are the decision makers on issues that impact their communities. Thank you, Katya, for being here. And also our other colleague, Natalie Simonet, works at Ramsey County 911, or the Emergency Communication Center, the ECC. She is dedicated to the Appropriate Response Initiative, working to transform the ways 911 responds to calls. She is also active in a community engagement at the Ramsey County 911 Center, leading a domestic violence prevention effort with focus on strengthening communication and collaboration. Natalie helps ensure effective emergency response while fostering trust between first responders and local residents. And our next colleague is Brenda. Brenda Abla is a committed advocate for the Appropriate Response Initiative, working to enhance community engagement and public safety at the Ramsey County 911 Center. By improving communication between responders and residents, Brenda plays a key role in ensuring more effective and compassionate emergency response. And lastly, our embedded social worker, Natasha Powell, she'll be speaking on her bio coming up as she presents as well the work. Katya, I'm gonna have you go ahead and start from, that's my bio that was already read, and start discussing the ARI and its mission and its vision.
Sure, thank you so much. And thanks for having us, everyone. So mission and vision of ARI, you can see here. In brief, we support 911 dispatch, public wellness systems, and community institutions to more appropriately respond to people in need. But practically, in Ramsey County, that means some expansions and some enhancements to our 911 system. So you can see there the bullet points. We're expanding our mental health crisis response, which has existed in Ramsey County for a long time. Creating a new public health response, which Luis will be speaking on tonight. Him and his team are active, so that is a response that's an active response in Ramsey County. Creating a community-based response, we'll talk a little bit about that. That is not yet active. And then also enhancing emergency communications center protocols for new response options. So really working with our 911 call center, which includes our embedded social worker. We're lucky to have Natasha on tonight to speak in detail about her work as well. So here is a bit about our call structure. If you look over on the left side, the green box says there's an incoming 911 call. So every part of the work that we're doing right now is connected to our 911 call center in Ramsey County. So we frame it up as everything is starting here with a 911 call. But we know that not all responses, not all 911 calls need a police, fire, EMS response. We call those our traditional responses. So a 911 call can come in, a telecommunicator then receives the call, and they triage that call and send it over to a dispatcher, usually for a traditional response, if that is needed. Right now, you'll see in that purple box in the middle, we have embedded social workers like Natasha who sit there in the 911 call center, and they provide additional questions. They do their own triaging around mental health, and then also chemical health calls. With the embedded social workers, they're only receiving calls that have a mental health or a chemical health component so that they can determine, is that a call that needs a traditional response, or can those calls go out to those top two boxes there, the Ramsey County Mental Health Crisis Response or our public health response. And then you'll see in the boxes, again, on the right side below there, community response is another one. not yet open, not yet running, but there as an expansion that ARI hopes to bring into fruition. Traditional response, of course, is still there. We know that many calls still require a traditional response and always will. And then down at the bottom, collaborative response. So that's any two of these call types going out together. It could be a traditional responder like a law enforcement officer alongside public health. It could be mental health crisis team alongside public health, community response, and fire. It could be any pairing of these. So that is something that is happening between some of the teams, and there's more to develop between other partnerships. Next slide, please. Thanks. So we talk a lot in ARI about community work and making sure that the work we do is embedded in community, and the direction that we go for ARI comes from community voice, community input. We know that these big systems, Ramsey County included, cannot transform themselves. We consider this transformative work, and we know that we need outside voices, outside perspectives, folks with lived experience to tell us, this is where the system is going wrong right now. This is where the system is harming my community or has harmed me and my family, and this is what needs to happen. So we rely a lot in ARI on the voice of community to really push us, nudge us, tell us when we're heading in the wrong direction. So at the beginning of all of this, we did have a co-design group that I was a part of prior to being a staff person at Ramsey County, actually. That was in early 2021. And in that space, we learned that between 2019 and 2021, there were major disparities in Ramsey County between who was being brought into the criminal legal system. We looked at arrest rates and found out that Black folks and American Indian folks were represented in our systems at a much higher rate than they are in our community. So that was kind of the driving force of ARI to say we can do better. We want to create safer and healthier communities as defined by those communities themselves. We want to increase well-being and wellness, again, as defined by those communities themselves, and then make sure that we're not unnecessarily looping people back to the criminal legal system when they don't need to be. For example, if neighbors are having a dispute and they're simply arguing back and forth, maybe there's been multiple calls into 911, we don't necessarily need to send out a law enforcement officer as the first step, as the first mediator. It could be a community responder. It could be a trained mediator, someone that has the skills to go out and intervene and, do their best to resolve that situation or get some supports in place for those folks prior to, again, looping people back to interactions with our justice system. Next slide, please. Thank you. So this is just a little bit more about how we see our work being informed. Of course, want to be data-driven. We're really proud of the fact that we have both internal evaluation of this program through our evaluator in Ramsey County, and then also external evaluation that has been with the Office of Evaluation Science at the federal level. And then community engagement. Again, we have our community team, folks that were part of that co-design back in early 2021 are still, 2022. We're still hanging out with us now. So they are 3 years now with our team. And some additional folks have come, a few folks have fallen off, but we do have voices that have seen this entire trajectory and continue to work with us. And then the last piece there is, if you go back to that blue circle, thank you, values. So making sure again that, big systems have values that they point to and that they want to be aligned with. But in the day-to-day, it can be really challenging to center ourselves in those values and systems that get bogged down with risk, budget, a lack of sustainability potentially in these pilot type programs. And so really relying on our community members to keep coming back and say, hey, you said you have a value of transparency. So let us know what's going on with this program, the budget, leadership change, what are the things that you can tell us and you can share with us and have feedback from us on. You also said that you want community voice. Maybe you spoke with community a couple months ago and they told you, hey, we really want to see you go in this direction. You let them know, oh, thank you so much for the feedback. If they come back in 2 months and ask you, say, what did you do with that feedback? We should be able to tell them and have that accountability. So really wanting to lead in this program with those types of values. Next slide, please. And then this comes from, again, kind of that root of our work. In early 2022, we looked at what are the long-term outcomes that we can look at in the future of appropriate responses initiative that will tell us, yeah, this is making an impact in our communities. So there in the arrows, again, a bit of a repeat from what I had mentioned, but improve wellness in community. Very, very broad, but really wanted to hear from communities most impacted, Black and American Indian folks, that yes, we're seeing this out in our community and we feel better because of these responses being in place. Second one, less Black and American Indian folks engaged with the justice system. That is measurable. We can look at arrest data. We can look at how our numbers are changing. We can look at interactions with law enforcement, how many calls we're sending out our traditional responses to versus our appropriate responses. In the green, less Black and American Indian people incarcerated. I mentioned that. And then finally, less folks financially obligated to the justice system. So making sure that people are not bogged down by unreasonable amounts of debt just based on having those interactions with the criminal legal system. And I will hand it over to Natalie for our ARI call flow.
I'll actually come off of mute. Me and Natalie are partners. No worries. Don't worry about it. We work very closely in the office and we're seen as one big, big, awesome team that we are. So, hi, everyone. Brenda here. Thank you again for having us. Pleasure to be here. So here, this slide here talks about our appropriate response initiative call structure. Katya did a really well job of explaining it, so I'm not going to add more. If anything, I'm just going to add in the green at the very top where it starts, the incoming 911 calls to the Ramsey County Emergency Communication Center, which we say ECC a lot. Our ECC does answer all incoming 911, so emergency calls and non-emergency calls. So they are dealing with two different calls, so administrative and emergency calls. And then our, when it goes down to the blue square where it talks about the 911 call triaging, we call our telecommunicators, the TCs. They answer all the incoming calls and they do all the triaging to figure out what kind of resource the call is in need of. So I'll go more into detail of what our telecommunicator does. Next slide, please. So the Emergency Communication Center, we receive, like I said, all calls, emergency and non-emergency calls. And we also take care of dispatching those calls. Little background of our center, we have two different roles. The main, well, not the main role, but one of the roles is our telecommunicators, and they answer all incoming calls. So once they're done with the call, they're kind of in wait for the next incoming call that comes to their council. Another role that we have is our dispatchers, public safety dispatchers, and they're in charge of dispatching calls to the appropriate law enforcement or fire trucks or ambulances. So two different roles. So the TC will take all information in and then send the call into the system for the dispatcher then to figure out who's available and who can I send to this call. So when the 911 call comes into the center, the TC will answer, and then the TC does have a set of questions, in other words, a triaging type of system to determine the support that is needed. Go ahead, next slide. This slide here shows what we like to call the 5 dubs. So the where, what, who, when, weapons, or injuries. We like to call this like the foundation of a call. If we have these answers to these questions, we almost have it all to get the help out there. So obviously the most important question when we're dealing with a 911 call is where, because if I don't know where you are, then I can't send you help, right? So where is the emergency occurring? What is the situation? Like what's the reason for the call today? Who's involved? Who's my caller? And then who are the people involved in the situation they're calling for? When did it happen? It's also very important because that's going to determine how soon the responder needs to go. If this is something that happened an hour ago and they just want to call and file a report, maybe, then we have time to send whoever is needed to go out to that call. In other words, when somebody is calling and they're having an emergent situation right now, they need help ASAP, then we're going to get a responder to that sooner than later. And then the weapons and injuries, that's important as well, not only to our responders, but to the community and the people involved in that. Outside of these 5 dubs, though, I do want to mention that there is additional calls additional questions that our telecommunicators will ask, obviously depending on the scenario. Next slide, please. Once the telecommunicator has gotten all the 5 dubs, all the questions that it needed, once they determine, okay, I know this call is either maybe police officer, maybe an ambulance and a fire truck, or maybe one of our appropriate response. So once they determine that, if a police is needed, additional questions for that might be, is there a current threat right now? Is it a physical violence? Those are some of the more specific questions that we need to know for safety of responders in the community. They ask about further questioning of the scenario, injuries as well. So if injury is part of a situation for the call, they'll have to enter that into our computer-aided dispatch system, which is CAD. They'll enter it into that saying medics are needed or not. And then if medics are needed, then we're going to also have to get pretty much bring on a third person onto the phone call, which is our fire dispatcher. They will do their questioning, which is pre-arrival instructions maybe, or some other just separate questions that our fire dispatchers are trained to do. If there is a case where both medics and police are needed, then that's what we call a joint response, because it's 2 different agencies responding. It's a fire or EMS, and then our law dispatcher. Our PD that goes out to that. I don't think I missed anything for that. Go ahead, next slide. I think I can hand it over to Natasha, who then will talk about that purple square that talks about embedded social worker.
Hi, I'm Natasha. I am one of our embedded social workers. I am actually a licensed clinical counselor here at in Minnesota and in Wisconsin. So I work the 14:30 or 2:30 to 2300 or 11 p.m. shift. I help triage mental health calls and public health calls, and that just means if the telecommunicator or TC has determined that this is probably something that could use one of our alternative responses or appropriate or different response, they'll send the call over to me and I'll ask additional questions. Some of the questions I might ask are, does this person already have a diagnosis? Are they connected to case management? What is their drug of choice? Things like that, to help determine, are we going to have public health and mental health go out? Is there any safety concerns? If there are safety concerns, I might have a mental health team and a officer go out to do a co-response. So I help triage the calls to help determine who's going to be the best response to go out with people who I have access to. All right, next slide. As I mentioned, I work the 14:30 to 2300 shift Monday through Friday. So we have 4 embedded social workers who are currently staffed. We almost work 24/7, 365, but we're not quite there. Eventually, as need continues to grow, that may grow. But we have 4 different social workers. There is overlap during busier times. One of our social workers works that morning shift to 6:30 or 18:30, Wednesday through Saturday, and then switches Sunday through Wednesday. Same time frame, just switches, and then Sunday through Thursday, the overnight shift. If there is a need for a mental health team at that time, then calls that are mental health related will get transferred over to the Ramsey County Crisis Line. So there are still mental health calls being triaged by mental health professionals. They just don't work in the ECC. So I right now am the only licensed mental health professional, but we do have mental health professionals that the practitioners are able to consult with if there is something that they need to consult with for licensure reasonings. Right, next slide. So just kind of some of the calls that we get and what our assessment might look like. We have 4 different types of codes that we will close out a call. So sometimes we don't even need someone to make face-to-face contact. In fact, most of our calls, we don't need face-to-face contact. Sometimes people are just calling and looking for resources, or calling and they need someone to talk to, or a resource that I can help connect them with. Obviously, if it's something that does need face-to-face contact, I help triage to determine who would be the appropriate person to go out. But sometimes someone just needs to kind of talk through what they're going through. And then I can provide them the crisis line if they need follow-up in the future. We also, I have used Luis in the past just to provide different resources. So I've called him and I was like, hey, I don't know if I need you to go out, but can you give me information about this organization? And he has so much information. So he'll just be like, yeah, you can refer them to this place. And so we kind of work as a team. It's really cool to collaborate with different organizations throughout Ramsey County. And so I know I've worked with emergency room social workers when sometimes people are calling 911 from the emergency room and asking for help, even though they're already there. And so sometimes I'll connect with emergency room staff and just say, hey, you have someone in your waiting room who might have went there for a different reason, but it sounds like something has changed and they don't know how to advocate for themselves. And so it's a lot of trying to figure out what is happening and putting pieces of a puzzle together. We deal with people who might be actively using and are looking for resources to get into treatment. We also are dealing with people who are feeling suicidal and are afraid to go to the hospital. So I might send a mental health team out to do an assessment and either get them connected to a crisis residence or be able to safety plan with them and connect them with a family member who can keep them safe. So that's just a little bit about what our triaging looks like. And we talked a little bit about what that looks like. I talked about those 4 different disposition codes. We do have a code that is unable to connect. What that means, even if we're not able to connect with someone, if they have a voicemail box, I'm going to provide them with some kind of resource. That means they can call us back at 911. They can call us back at a non-emergency number, or if it was something that they were having difficulties with their mental health, I'll give them the crisis number and they can talk to them specifically. So we have those different codes. And sometimes while I'm on the phone with someone, things change and I need to switch over and have a traditional response. I might need police and medics to go out and make sure this scene is secure. And I'll have them go out and then alert the crisis team so they can meet with police and medics as soon as they're able to. Obviously, police and medics, they go out lights and sirens, and our public health responders and crisis team, they're in their vehicles, so it takes a little more time. So if things have changed, sometimes it takes a little bit of a different response, but it's all about collaboration and trying to identify what is going to be best for that person in the community. So next slide.
Thank you, Natasha. Appreciate those details. Now I'm going to take it on here from the public health responder perspective of the ARI. So on public health response, it is not a traditional response like the emergency medical services, like you guys have seen in the previous slide decks regarding the triaging of calls. We are dispatch response based on public health perspective, so much more community facing. And as Katya mentioned earlier, much more accountable to the community and their needs. We, as public health responders, have different experiences, educational background, focus on harm reduction, safe use education, and access to resources, the treasure trove of resources like Katya mentioned as well. And we respond to substance use related calls in various cities in Ramsey County. Nothing relating to current overdoses or medical emergencies, because as Katya put it, or excuse me, not Katya, Natasha, safety is a big priority in the work that we're doing, and that's most of the folks' concern when we're discussing public health responders is how safe is it, what's going on. And I think thus far, the ECC and embedded social workers have done a great job of making sure that our safety is a topmost priority. So public health responders criteria to be sent out is, as I mentioned before, is a non-medical emergency, no overdoses, no weapons, and it's substance use related or substance use involved. For instance, we've had callers call into 911. Natasha has taken the calls and she's getting complaints from folks who might be consuming cannabis. That's a very frequent call that we get. Folks will consume cannabis, and with cannabis laws being much more open and legalized here in Minnesota, some folks might not realize that they can actually consume cannabis in their own places of domiciles or private homes. So there's a lot of those calls that we get sent out. I've gotten sent out the calls relating to the calls like that, or I would just simply get dispatched to those calls, and I would educate folks about proper usage of cannabis use in public spaces. We carry a couple of equipments. We have a computer assisted dispatch laptops. I call them the big police tough books. They're very rugged, robust laptops. We have a combined radio and cell phone with dispatch that they're always able to get a hold of us, either through text or a call or a walkie-talkie feature. And then we carry also backpacks filled with puncture-proof gloves, bandages, naloxone, which is really huge. We have also xylazine test strips, which xylazine is really huge right now in the community as well. Safe use supplies. We also carry in our vehicles, for instance, in the cold season, socks, blankets. We have bus tokens. We have energy bars, just basic need supplies that we can try and build that connection with that individual out in the community, because it's all about building trust. Once we are able to build trust with an individual, then we can begin to do the work that's needed for healing. So this is currently, this is a map of Ramsey County. We've launched in February of 2024 in New Brighton, Mounds View, and Maplewood. So we're mostly in the surrounding parts of St. Paul. We're not officially launched in St. Paul yet. However, there's ongoing discussions with St. Paul as to how we're able to get this work off the ground and in collaboration with within an urban setting. However, we are mostly getting dispatched to surrounding areas within St. Paul. So as I mentioned, we have right now 2 current public health responders actively responding to calls in New Brighton, Mounds View, Maplewood, Shoreview, Little Canna, Baton Heights, White Bear Township, and Falcon Heights. We did have 4 individuals, but now we're just down to 2. Ramsey County has gone through a lot of different changes. We got a new public health director, many vacancies that are slowly but surely getting filled. So as folks know, anything regarding to government, things don't move at a quick pace. We have to be a little bit patient with how things move over here. So with that expectation, you know, we're able to still meet the demands of the community and the calls that we're receiving. Response times are currently Monday through Friday, 8 to 10 p.m. And these hours may change depending on the needs and the data that we're receiving coming in. If we're receiving more calls coming from a certain sector or a certain area, those hours could change. And then, as Natasha put it, we are dispatched by the ECC, by the embedded social workers, and we have county vehicles that are available to us with it's like a whole rig set up with our computers and our radios and all of our resources that are in the back of the vehicle as well. And Natasha, if you don't mind touching on the mental health crisis response, if you could be so kind.
I do, yeah, or I will. I did see some questions in the chat. So one of the questions was about triaging. So we do have some responders, I know in the mental health side that does speak Spanish. We also do use interpreter lines, and we use interpreter lines at the ECC as well that is connected to a very wide range of languages. Ramsey County is very diverse, and so we have the easy access to language lines, so we can connect pretty readily to people who speak multiple different languages. And then making mistakes for sending community response for conflict de-escalation when traditional response was needed. If that has happened, what steps do you take to avoid future mistakes? So
Can we, Natasha, answer those at the end?
Oh, yes, yep.
I'm sorry.
Okay, yep, no, we could do that.
Thank you.
So mental health crisis response, and you could skip this slide. The adult, children's, and mobile crisis response units. So every county in the state of Minnesota is required to have some kind of crisis response team in the state of Minnesota. Ours is staffed 24/7, 365. It is not contracted. It is Ramsey County owned. We have a crisis line that is a 24/7 line. You can call in. There's the children's line and adults line. It does roll over to each. So say if you're calling adults and all of the adults are on calls, it will roll over to a children crisis staff. And that's just to make sure that the information is getting gathered as quickly as possible. Staff are trained on being able to triage those calls both ways. Children's crisis actually will serve up to 18. It gets tricky when you're 18. If you're still in school, children's crisis will be the one that usually responds. What they do is they'll go out to the community. They also do have a location at 402 University where they can do a mental health assessment. They can get you connected to stabilization, which is kind of like a short-term case management service. They also have psychiatric providers, so they can get you in within a couple days and get you psychotropic medication. So, all right, we can skip this one. And so, like I had mentioned, that in person, we do have the walk-in hours. There is children and adult stabilization services. They do a lot of responses within schools, within community spaces that are private. They do follow HIPAA, and so they will make sure that HIPAA is followed. So if like a library has a space where you can have a private room, they can do an assessment there. They often go into homes. There have been a few in parks, but we always are making sure that safety is happening. All of our responders are either mental health professionals or practitioners who are working under a professional's license. So every person has consults within 3 hours of a face-to-face assessment. So once an assessment is conducted, the team goes out in pairs. They will consult with a mental health professional afterwards. They will go out and assess for if someone is a danger to themselves or others, and then they can write what is called a transport hold that assures someone is able to get seen by a provider at an emergency room setting. That is different than a 72-hour hold. Oftentimes people will call and be like, this person needs a 72-hour hold. That is not something that crisis staff or social workers in a crisis setting is able to do, but they can write what is called a transport hold. And that is when someone is not able to care for themselves significantly, if someone is actively suicidal or has a plan and you're not able to safety plan with them, or if they are homicidal and has an active plan to hurt someone. So, all right, thank you.
And thank you, Natasha. And Katya, if you don't mind taking us through the last phase of this ARI work,
Mhm.
community response.
Wonderful. So community response. We'll share that community response is something that during the planning stages of ARI, again, back in early 2022, we had space for traditional responders, leadership in those spaces, many Ramsey County departments, leadership from public health, from our 911 center, from what else? Our crisis team, absolutely, social services, folks from all over the place, representing kind of their own experiences with their systems that they work in. And then we had community members in that space representing maybe lived experience with mental health concerns, with calling 911 and getting a harmful response, folks from immigrant and refugee communities, folks from many different diverse communities in Minnesota. And one of the things that emerged from those spaces was a need for a community response. At the time, we weren't talking in specifics around crisis team enhancements, around embedded social workers, around public health response. We were really thinking, beyond these traditional responses of police, fire, and emergency medical services and crisis, which was there actually at the time already. What's the missing gap? What else could we provide to community members who are in need? And so the general term that arose out of that space was community response, something that was a team of folks that were already embedded in the communities in Ramsey County. They knew the neighborhoods, they knew the needs, maybe they personally knew families, right? And could go out and serve folks in a way that would address concerns like those listed here: neighbor disputes, family conflicts, supporting kids, providing certain types of aid and resources to individuals, and then location-based support we'll talk about a little bit more, but really wanting to lift up the need again for a response that came from outside of the system. So as ARI has continued over the years and we've continued to move toward and plan for a community response, we're really still looking at something that is not embedded necessarily in Ramsey County, not staff hired into Ramsey County that have a community lens, but some sort of standalone group of folks that work alongside Ramsey County, have the equipment to respond to a 911 call, but are deeply embedded in community and trained by a community organization to go out and serve the folks that they know best. So I'll have you move to the next slide. We'll look at some call types and where they fall with the responses. So actually, I'll move your eyes over to the far right in community response. So as we've continued to dream up community response, these are the types of calls we're talking about. If you ever get a chance to come and listen to 911 calls coming into our emergency communications center, one of the biggest surprises to me was that people call for all types of things. I don't know, when I've called 911 in my life, I'm shaking, I'm nervous because I'm calling for something that feels like a life or death situation, but people really utilize that resource in all types of ways. As Natasha outlined, sometimes it's for a basic level of support, a conversation, some ability to stabilize for the day. Sometimes it's for these other types of resources on the right side. My neighbor's blowing leaves into my yard and it's driving me crazy. Can somebody please come out? Sometimes it's parents really struggling with their kids. They don't know what to do, but they know that they need support. So asking for someone to come out to help get a kid to school. It could be a parent or a business owner at a store dealing with kids running around. And again, kids won't listen. We need some level of support. We're not sure who, but it could be all types of things, again, that fall in that right side. So those are the types of calls that we're looking at for a community response. And you'll see down at the bottom the location-specific support that I mentioned. So that could be specific calls coming from a group home or a congregate care facility where, again, some level of support is needed, but not one of those traditional responses. It could be a rec center. It could be one of our Ramsey County service centers just saying, hey, could you provide a presence, somebody out here just to kind of see what's going on today to keep folks engaged and in check. Or it could be a dispute over a business payment. Somebody coming in and providing funds to a store owner, and the store owner doesn't want to enforce, again, with law enforcement, but would like somebody to come out and provide some mediation, or things like graffiti in the park. Then if you look at the other two columns, these are a bit more defined. Public health response, this is the full list of the types of calls that public health response is currently going out to. So could be things like substance use related welfare check. Again, there's a lot of gray area and a lot of nuance to a 911 call. So we have levels of triage that have been outlined already tonight, but a call could come in and there's a substance use need paired with a mental health need. And so again, we really rely on those layers of triage in the center to determine who is the best responder to go out. So I'll give you a minute just to look at the calls that fall under these before we wrap up and move to questions that folks have. All right, I think we can move on to questions. And yes, there was an abundance in the chat, so I'm not sure where we want to start. Luis?
Sure, I'll read them out loud here. Let's see, let me get the chat. Some questions about triage, as Natasha was speaking about. Do you have responders that speak Spanish or Somali? And have you made mistakes like sending community response for conflict de-escalation when a traditional response sending police was needed? If that has happened, what steps have you taken to avoid future mistakes? So I'm going to speak to the first part of that question. So I myself, I'm a native Spanish speaker. So we have individuals in the team that do speak multiple languages, but like Natasha spoke about, we have the ability to speak with language line translators. I know it's not the best because it's not community facing. However, it is a helpful tool that we can use in relation to building that connection with folks who are not native English speakers. Now, as far as the second part of that question, confusing responses during de-escalation when traditional responses of police was needed. Thankfully, I haven't gotten on a call like that. However, what we've done when the embedded social worker has given us the information about a specific call, particularly around weapons or self-harm, we have done the pause and then we'll be like, you know what, police is not here. Let's call back the embedded social worker, make sure we get dispatched, a squad car out here. I actually went to a call like that a couple weeks ago where an individual was speaking about self-harm to an ex-girlfriend. The ex-girlfriend called the ECC, and then Natasha was able to, their group was able to dispatch us with mental health crisis. Mental health crisis and I met at the individual's place. However, with the threat of weapons being used, we then just got a hold of traditional response police. They were able to come. They were able to clear the individual, make sure that there was no weapons going to be used. The police left, and then we were able to provide whatever resources that individual was willing to take the call, take from us. They were not willing to take on much resources besides the pamphlets that we were giving out. And we have to be mindful also. People have to be willing to receive these resources and help. We can't force individuals to want to take these resources on. Unfortunately, that individual that we went out to, we ended up finding out that he ended up taking his own life. So that was hard to hear. But the wonderful thing about Ramsey County is they do give us resources to make sure that we get around those vicarious traumas that we inherently are going to be exposed to. So that is a dark side of the work that we do. Is we're not going to be able to save everybody, but we were able to make that initial connection and say, hey, we are here for you. We do care for you. And it's upon the individual to make sure that they take that initiative. So I know it's a little bit of a downer what I just said, but it's the reality of the work that we're doing, folks. And I want to make sure that I'm as honest as possible about this work. Anything else, team, that you want to add on to that?
I would just add, I think that the concern about making sure the right response goes out is on everyone's mind doing this work. When we talk about the most appropriate response, we're including traditional responses in that. We want to make sure that it's a collection of opportunities of responses that people can receive. And so all the folks that are interacting with the 911 call are thinking, what is the best response for this individual? And so now that we have a broader array of options, again, doesn't necessarily mean that it has to be just a single one. It could be a pairing if that's needed. And then I would say another thing that happens nationally, we're looking at the research in many different jurisdictions where this work is happening. everybody's thinking about risk. How risky is it to send out somebody who's unarmed to a call that could change at any minute, right? We're all human beings. We know that what happens on the phone could be different when you get out there, could be different 5 minutes later. And so everybody's thinking about that. And there's some really amazing data across the country that, after thousands of calls going out, less than 3% in some spaces, and in most spaces, less than 3% of calls need backup or need an additional traditional response after a community response goes out. So somebody unarmed went out, they provided their services and resources, spent some time with folks, and then less than 3% of those calls needed law enforcement backup or another traditional response. So it's great to be in good company across the country where we can kind of reference those things and say, yes, it feels risky, and we're all human. Again, we recognize the broad spectrum of things that can happen out in the world. We want everybody to be safe and well, but also there's some real benefits to being able to send out a lower level response when that's the need.
Thank you. And then to the next question, some questions about evaluation. How internal and external evaluators interact? And if the funding for evaluation coming from federal level with recent federal changes, can this funding be taken away?
Yes, I can speak to that. So our internal evaluators do speak with our external evaluators. They're at a monthly cadence. I believe they meet at least once a month, but it could be twice. So they're in good connection about the work that's happening and kind of checking each other, their methods and what they're working on. In terms of funding and the ability for federal funds to be taken away, yes, I think that's on the table for many of our programs across the country, and a lot of the things that are meaningful, right? We're seeing those cuts happening and recognize that that is something that could be in jeopardy, certainly.
Thank you. And then the next question was about intentional focus in the criminal system. I saw focus on Black and American Indian. Isn't the need also in the Latinx, Hispanics communities? Why not including them?
Want me to take that?
Yes, I think you should take that.
All right, I'm happy to do that. So if you look at our kind of deep dive from 2019 to 2021, when they looked at the information from Ramsey County, the categories are pretty specific. We all know that racial categories are not great. They break people into groups that they may or may not identify with. They leave a lot of people out. And so I don't think Latinx was even one of the categories in that race data. I know we had white, Black, Asian, American Indian, and then I think there's other. Not a great representation, but when you look at the Black and American Indian categories, it's wide disparities between those. And one of the things that we're proud of in this work is that we're not just focusing on those communities. Certainly, that's the crux of the work, to say, hey, look, different populations in our community are getting widely different services, are being treated in vastly different ways. And we know that if we improve it for the folks that are most impacted, we improve it for everybody on that spectrum. And so expanding resources that work well and improve wellness in the Black community, for example, expands resources for everybody. We're not saying, hey, these resources will only go out if you're a Black caller, for example. No, these are resources that are available for everybody in Ramsey County. And then we're measuring wellness, we're looking at arrest rates for those populations where we can say, look, we're making a difference. And we know that because we have the data from before. Now we can look at where we're at now. I hope that helps.
Thank you, Katya. And I'm going to definitely add to that question as well, response. So I met last week with some community members that serve the Latinx Hispanic communities. And the main concern now is the fear of calling 911, because there's this stigma of calling 911 and it's just police, it's just police. However, we are in ARI here trying to change that narrative as a community-facing member of this organization to make sure that it's all encompassing. You can call for whatever it is, but if it's a public health need, you're going to get a public health response. Like Natasha mentioned, particularly around resource. She was able to call me that one time. We connected over the phone and we got that individual plugged into the appropriate resource. But also, when I spoke to this Latinx community member and organization, I make sure that they understood that they are able to get the messaging out to their communities about public health, no police, none of that threat of ICE or immigrant force, threat of arrest, because I know that's a real big fear right now in the country. So that's kind of the messaging that I've been working around, and it's going to be a long way before we get folks to really trust you know, how to change the narrative around 911, because we all have fears of calling 911 for the most horrendous things. But you can call 911. There's people who call 911 just to chat it up with Natasha and have a conversation with her and have regular conversations with folks. The people call 911, like Kadia said, for the most darnest things. But again, just changing that narrative, I think, is going to be really important, and we've begun to do that. Any other questions for us, myself and my team? I know it's a lot of information to take in. This work is constantly evolving, but everybody you see here is very dedicated to the work. And I can definitely say that I can call any of these individuals with any questions, comments, or concerns, and they'll pick up that phone and give me a call back or write me an email. Or there's dedication here, and that's what's needed again for this work to really take off and slowly begin to change that narrative.